Hello, everybody. My name is Joe Santana, and I am the boss list of Tau Iota Chapter of Omega Psi Phi Fraternity Incorporated. I'd like to welcome everyone to this momentous occasion. Tonight, we will hear from a group of my fraternity brothers about this COVID-19 vaccine and how it impacts communities of color. For over 109 years, the Omega Psi Phi fraternity has been a beacon in our communities. We've strived our best to serve and to be the driving force around change across the world. Tonight is one of those nights. Locally, in Hartford, Connecticut, Tau Iota Chapter will be celebrating 75 years next year of serving the Hartford community. While we plan that momentous occasion, we are reminded of the times that we're in. This world is dealing with a pandemic, the likes we haven't seen in many generations. So with that in mind, we wanted to ensure that the folks on this call have the proper tools to understand what's coming with this vaccine. What we would like to do tonight is not try to convince anybody of what course of action to take, but make sure that they are equipped with the right understanding of what this vaccine actually is. As we begin, we would like to bring up a poll question to kind of ascertain exactly what everyone's feeling is on the vaccine at the beginning of this meeting. Just give your honest answer, and we'll be following up with a poll at the end of our meeting as well to see how everyone's feelings are about the presentation. So as we begin, I'd like to introduce my fraternity brother, Greg Jones. He is the VP of Community Health and Engagement for Hartford Healthcare, as well as the member of the communications subgroup of the COVID-19 Advisory Committee for the state of Connecticut. Brother Jones, thank you.
Thank you, Joseph. I appreciate it. I'm looking forward to this evening's conversations as well. Thank you to all of you out there. It's a pleasure to see you. Trust me, we can. I feel you coming through the screen. We're going to talk about a few things this evening. I'm glad to be the pregame, the opening act for Dr. Eadie. The intent is to level set our discussion, to give you a baseline and a backdrop that will help you understand. And as Joe said, we really are here to try to inform. I couldn't have said it better than our lead-in song by Mesa Lee. All I do is think about you. And that's really what we're here to do tonight, is think about you and our community and how we can share information to keep you safe. We'll move to the next slide. What we plan to do is initially share with you a few social science observations. As Joseph indicated earlier, facts fighting fears. I will play a little bit of a social scientist at the beginning. A little bit later, I'm going to play an epidemiologist. So for all the epidemiologists out there and all the social scientists out there, allow me into your world just for a second. Earlier in November, the Legacy Foundation conducted a survey. It was intended to be directional. It was directional in that we engaged about 500 to 600 persons, primarily in the zip codes of 06112 and 06120. And for our folks that's out of town that are viewing us this evening, that is the urban area of Hartford, Connecticut. With that, we got a little over 10% response rate. So intended to be directional, but what we found is that it was right on top and consistent with some of the national surveys. What we found is that 50% of the respondents, that they were very unlikely to seek out the COVID-19 vaccine when it was available. The charts here show that indication. The top two left bars indicate that particular indication. So more than 50% said no. I think the number in some of the national surveys were about 40%. It started to trend up now that the vaccine has become more available to around 60%. Next one. What we also asked was, where did your trust lie? We found that 86% of the respondents agreed or strongly agreed that they trust their primary care physician. 35% trusted local and state officials, and 20% trusted federal officials. What this indicated is that the farther you got away from them, the less trustworthy you were. So you have a close relationship with your primary care physician, you have a very trusting relationship with him or with her. What we then looked at, the next one, please, is let's unpack the COVID vaccine receptivity and hesitancy. So what we found is that 86% of the primary care, 86% of the population of our survey audience trusted their primary care physician. 50%, however, were unlikely or very unlikely to get the COVID-19 vaccine. So what that indicated to us was a gap. How do we close the gap? If 86% trusted primary care physicians, but yet 50% are unlikely, then we need to get primary care physicians and medical doctors, trusted individuals, in front of the general public, i.e. Dr. Eadie later on tonight. That's really what we took away from the survey. That gap of 35, 36% said to us, we've got to get more primary care, more trusting primary care physicians, folks that look like them, folks that live in the neighborhoods, folks that they can feel comfortable with, to talk about and give them the facts. As Joseph said earlier, we're here just to share the facts. Next one, Abby. But before that, let's talk about the proverbial elephant in the room. The medical community's relationship with Black and brown people, among others. You know, Google is a wonderful thing. We can find this data and find this information out just as easily as we did. But what has happened is the medical community has earned the mistrust that certain communities give it. And they've earned that mistrust based on historical facts and historical incidents. Most of it has been around experimenting without consent. Trust you've heard in Henrietta Lacks. Doctors at Johns Hopkins took cancer cells from a dying patient for biological research. Maybe you heard about the Holmesburg prison experiment, the creation of a skin cream with a series of painful experiments with the prison population. Or J. Marion Sims, who was thought of as the gynecologist. They conducted reproductive experiments on enslaved Black women. Tuskegee syphilis study, it's pretty popular. A lot of folks have heard about that, even in our survey. It's a 40-year experiment of 600 Black men. Or perhaps you've heard of the start in the 1950s of birth control pills in Puerto Rico. All of this stuff is not just historical, as we still face issues and challenges in medical and with folks of color feeling comfortable in their medical establishment. We understand that. That's the elephant in the room. So we understand that we're not here to gloss over the facts that occurred in history. What we are trying to do is share information and share dialogue that may be helpful. What has happened since then? Since Tuskegee, there have been a few things that have happened. The National Research Act, the National Commission on Protection of Human Subjects, basically says required voluntary informed consent. Studies involving humans were subject to an IRB board, and it's been continuation of ethical standards. At least there was some recognition that what happened in Tuskegee was wrong. And in order to try to correct that, let's figure out where the problem and what the root cause was. A large part of it, certainly with all the other things that we may face, the systemic racism and others, but was informed consent. So now, as you were here in one of our interviews with one of our participants talking about informed consent. So all of this, we baseline in terms of what's next. Where do we go? And the summary of our survey. Next one there. These are the things, as we sat down and we talked to medical care professionals, things that you will hear Dr. Eadie address. Vaccine has been rushed. Development has been driven by politics and science, not enough clinical trials, ethnic diversity, proof of effectiveness. Folks say continue to follow the science and only the science. Do your due diligence regarding the vaccine. Those are the things that we're going to try to address this evening when Dr. Eadie gets into his very informed and very detailed presentation. Next one. But the vaccine needs help. COVID-19 is raging like a forest fire. Just think about that. We have 200,000 infections per day across the country. Even with a 95% vaccine efficacy, it's a powerful water hose, but that alone cannot put out a forest fire. In September, there were 35,000 infections. We're at 200,000, six-fold increase. Infections are spreading, outracing the ability of the vaccine. Just think about this for a second. The fire hose cannot put out the forest fire. We need help. The vaccine will need our help. Mask, appropriately and all the time. There's even some research that's talking about multiple apply masks. Wear them. Dr. Eadie will talk about them. Wear them all the time and wear them appropriately. Avoid unnecessary travel and gatherings. This is the part where I said I was going to be an epidemiologist. So all the epidemiologists out there, allow me into your world just for a second. Avoid unnecessary travel and gatherings. Minimize and eliminate. Ask yourself, is this trip really necessary? I know we're social, we like to get out, but think about what's happening. 35,000 in September, 200,000 December, and the holidays are just beginning. Social distance, avoid groups. Act and assume that everyone has COVID-19. Everyone has. Think about that. Think about what you can do in addition to considering and thinking about the vaccine. What we're going to move into next is a couple interviews and videos that we have. The first one is with our fraternity brother, Kevin Thompson, who is a nurse at UConn Hospital. When we talk about, and you've seen the signs, we love essential workers and thank our essential workers, think through what he explains to us in the interview we had with him.
Hi, my name is Kevin Thompson. I'm a registered nurse here in Connecticut. Before the pandemic, I was working on a post-operative orthopedic floor. Since the pandemic, I've been working on a surge floor, which is a floor that pretty much was developed to be an overflow floor for COVID patients. Currently, I live at home with my wife and 2 children. As you can see, I live in a lovely basement, 5-star living situation here. But the truth is that due to my concerns as a father and a husband, I chose to live down here to pretty much avoid my family because I know that I'm a high-risk employee. To be honest with you, I have some of the same fears that everyone else has with the vaccine. I'm concerned. It's a new technology. It's a new vaccine. But I can't afford not to take the vaccine. I can't afford not to try something to help my family. I can't afford not to be next to my wife. I can't afford not to lay next to my kids. I can't afford it. So the truth is that I have to try the vaccine in order to get back to some level of normalcy around my family and my loved ones. And I can't be the danger that walks through the door every day.
Thank you, Kevin. So Kevin is a nurse. The COVID vaccine, COVID-19 is serious. To all of our healthcare workers and our essential workers that are out there on the front line, thank you. We can't thank you enough. and we're going to try to do our part to keep you safe and to beat COVID-19. Mask up, less social. Our next interview that we conducted is with Dr. Corey Harwell. Dr. Harwell is assistant professor of neurology at the Harvard Medical School. He is a participant in a vaccine study.
I'm currently an assistant professor in the Department of Neurobiology at Harvard Medical School. You know, my view as a scientist and as a Black person in America, I understand the reluctance about the process, but I think that with that, there's also opportunities to learn more about these processes and actually have a lot of faith in the integrity of the process and the integrity of the people who are carrying out this work. And you know, why all of these companies and all the scientists that work at these companies and all of the work from the scientists that work at the National Institutes of Health are, you know, stepping up to this opportunity to have a positive impact. I would definitely take it. I hope that my family does. And again, just going back to the personal motivation is that, you know, we know the risk for this virus, and you know, the risk is death and depending on your comorbidities and your age, that risk is even higher. So again, you know, thinking about my parents and you know, the health issues that they have, if there is a safe alternative for them to avoid infection and potentially death from this virus, then I want them to, you know, feel safe and feel secure about being able to take that.
So those videos also the full interviews with Kevin Thompson and Dr. Corey Harwell can be found on the website listed here. I will then now turn it back over to Joseph, our bossless, for our next introduction. And thank you, and I enjoyed chatting with you. Hopefully there's something I've said has been informative that you might take the next step to help us beat COVID-19.
Thank you, Brother Jones, providing that great information. And also special thanks to Brother Kevin Thompson and Brother Corey Harwell for agreeing to interview with us about this very important topic. Next, I would like to introduce Dr. Reginald Eadie. He is the president and CEO of Trinity Healthcare of New England, as well as the co-chair of the Connecticut COVID-19 Vaccine Advisory Council. Brother Eadie, take it away.
Thank you, Brother Bosses. And first of all, let me say thank you to all the participants. Let me say thank you to Nurse Kevin and Dr. Harwell for expressing and demonstrating transparency and making themselves vulnerable. As our leader, our Brother Bosses, Joe kind of indicated, we are not trying to twist your arm and convince you to take the vaccine. We are simply trying to arm you with the knowledge so that you and your family members can then make an intelligent decision on what to do. But I will say in advance of the presentation that to the extent where I sound biased, that I'm promoting the vaccine, I have no personal financial interest in any of these vaccines. I am an emergency medicine physician who have been blessed to lead a phenomenal healthcare system in New England. And let's jump right in. So, you know, my mother, who is likely in the audience, would not be satisfied if I didn't start my conversation off giving glory to God. So I wanted to share my favorite, or one of my favorite scriptures, which I think is germane to today's conversation. And it is Hosea 4:6, which says, "My people are destroyed because of the lack of knowledge." My people are destroyed because of lack of knowledge. Why? Because you have rejected the knowledge. For people who that doesn't resonate to, how about this? Knowledge is power. Information is liberating. Education is the premise of progress in every society and in every family. You see, although today's conversation is geared toward communities of color, the reality of it all is that we all collectively, despite your religion, despite your demographic, despite your socioeconomic status, unless we all roll up our sleeves and do the right thing, it is my submission to you that we will be forever wearing masks, seemingly, and social distancing. And I can't wait till I have the opportunity to not be 6 feet apart from my friends and family, to not shake hands when I meet a new woman or male, to not be close to people who we don't see every single day or don't live in the same household. So if we are successful in today's event, you will have something to think about. You will have the knowledge to move forward and make your own decisions. So, you know, these are unprecedented times, and I coined the term tridemic. And what I mean by that is this is the first time in the history, recorded history of man, where we've seen sort of a three-headed crisis. One, obviously, is pandemic, so the community health and well-being. Two is the economic turmoil that comes as a result of the pandemic. Many of us are indirectly or directly have faced to some degree. We know someone very close to us who has undergone some hard times during this pandemic. And then third, which is not a novel concept, but something that it's now getting the platform and the attention. I applaud everyone out there who's done their part to shine the light on social injustice or systemic racism. I mean, that's who we are. Listen, we are all in this together. This is one community. This is one America. This is one globe. And we together can take on this crisis, this three-headed crisis, if we do the right thing. I happen to believe, as a side note, that in order to reverse those three heads of this tridemic, we should first start at social injustice and systemic racism. And once we fix this, then we will also in parallel fix the economic turmoils that vulnerable populations and communities experience. And then we will better prepare ourselves, because these kind of pandemics happen once around every 100 years. And we must prepare ourselves to better handle the next one that is yet to come, because there will be another pandemic. This pandemic has divided us as a nation. Omega Psi Phi Fraternity Incorporated has taken on the responsibility to close the void in the gap, to bring us back together as a nation, as God's people, to ensure that we position ourselves in a much better situation. So I thought I'd talk about Operation Warp Speed, which is the leading cause of anxiety or hesitancy, is what the scientists are calling, around the vaccine. Also, I want to spend a little bit of time talking about all three vaccines, but I will spend most of my time on Pfizer. So Pfizer is in your state regardless of where you are. And I know we have participants from across the country. And then I will conclude, as Brother Jones indicated, on proper masking. And I'll talk about what mask works, what don't, how to wear a mask, and how to test your mask to ensure that is working. So you don't want to leave early. You want to stay around for the remainder of the conversation. As Brother Jones indicated, remember back in 1977, I think it was May 16th, if my memory serves me correctly, the president at that particular time, President Clinton, apologized to people of color for the misbehavior of the federal government. Now, we're not casting judgment. It's yesterday. It's a rearview mirror reflection, but nonetheless, it's real, and that creates hesitancy, and we're very sensitive to all of that. We see the texts that are coming, the questions that are coming in the chat box. Remember to put your questions in the chat. But nonetheless, it's real, and I am proud to announce to the state of Connecticut that hesitancy is valid in communities of color. And then the HeLa cells for the scientists on participating in this conversation. I mean, Henrietta Lacks, I mean, the fact that the people in Tuskegee, Alabama, those 600 plus people, and Henrietta and her family, although she was suffering from cervical cancer, had no idea that these two things will be relevant in today's conversation. And then there are the other narratives out there, which I'm sure we're going to talk about, and that things like, you know, the microchip in the vaccine. So we'll address all of those, but most of our attentions are going to be focused on the top three things that create hesitancy in communities of color. And listen, while we are focused only on communities of color, this is knowledge, this is truth, this is science, these are facts. They're applicable to every single person, every single household, every single community in our country. I will remind you that we just experienced the deadliest week ever in the history of medicine. Listen, remember, you all know the top three causes of death are 1, cancer, 2, stroke, and 3, heart disease. Well, not anymore. Not since last week. The number one cause of death. I mean, it's sad. It saddens me, the reality that more than 3,000 and soon to be 4,000 people die every single day because of this pandemic. You know, Dr. Fauci is someone who I, to some degree, look up to, idolize, and respect greatly because he's a man of truth, right? He gets the bad rap all the time, but he maintains his composure and he delivers the science and he delivers the fact. He said that things are going to worsen because of Thanksgiving, because of Halloween, because that's when this resurgence really started. Opening and closing of schools, and then Thanksgiving, and then Hanukkah, and happy Hanukkah to anyone in the audience who's celebrating the last day. And then there's Christmas, Kwanzaa, New Year's Eve, and then New Year's Day celebration. And then the Three Kings Day. These are all times in which we, human beings, like to be with our friends and family to celebrate such important days in our communities. But what comes with that is the fact that we're exposing ourselves to people who may or may not have the vaccine. The result of that, as you know, and I realize I'm being redundant here, but the result of that is an increased number of infected citizens in our state of Connecticut and throughout the United States of America, which means that more people are going to need hospitalizations. There's only so many beds in every hospital, in every city, in every state across the country. So it taxes the hospital system. And then after that, some of those people are going to end up dying. And that's why we're approaching 4,000 people a day. So something has to be done. Listen, you're smart enough to know that if we do nothing, you can forecast what's going to happen. More infections and more deaths. So we have to do something. By the end of this conversation, and when we take the poll, we're hoping that you at least have enough information to feel much more comfortable to take the vaccine. This is science, ladies and gentlemen. This is fact. On November 27, Dr. Fauci said that we will likely by the mid of December, the middle of this month, today's what, the 17th? By the middle of this month, we will surpass 300,000 deaths. Was he correct? Absolutely. Because 2 days ago, we were at 303,000 deaths and growing. So not only was the science on point, but it gave us a forecast into what is bound to happen. And ladies and gentlemen, things are gonna get worse before they get better. Now, what you do and the decisions that you make based on the knowledge that you receive today will determine how many more people are gonna die. Because even if you don't, somebody else that you infect, if you get infected, may die. So here are the stats on yesterday, and these are the total number of deaths. And this is real, ladies and gentlemen. We're at 3,652 deaths as of yesterday, and every single day it seems as if it's reported that we're breaking new records of death. This is nothing to be proud of, but this is something that we can wrap our arms around and control. So let's get into a little bit of science. I'm going to use Brother Jones's terminology. I'm going to ask that you allow me to come into some of your spaces. I am a physician. I'm a hospital administrator, so I know the healthcare space. I am not a researcher. I do not work for Pfizer, Moderna, AstraZeneca. But what I do know is that, and Dr. Fauci in this article said it, that unless an overwhelming majority, we're talking 70, 75, 80% of Americans roll up their sleeves and take the vaccine, we will be wearing masks and social distancing for far too long. To the extent what we're asked to do, what we're asking you to consider to do, we're not asking you to do, we're asking you to consider to do based on the knowledge. The goal here is to reach herd immunity. So what exactly is herd immunity? Well, let me take a step back and just first say it in layman terms before we look at the scientific definition. Think about the chickenpox, right? Many of us, particularly those in communities of color, I know this for sure, when one relative or classmate or sibling got chickenpox, our grandmothers made everybody come and play with the kid who had chickenpox. That kid was the most popular kid. And while my grandparents knew nothing about herd immunity, they knew that if we expose people to the chickenpox, then we will create herd immunity in our family, which means we could create herd immunity in our church. We can create herd immunity in our communities, and then we have done our part to eliminate the chickenpox. Well, there's two ways to reach herd immunity. There's passive herd immunity through a vaccination, and then there's the exposure of herd immunity, the direct contact with the disease. Now, I talked about the chickenpox, but it will not work for corona because the more people you expose, the more people will die. So we can't take that rate. And I know that there is a narrative coming out of Washington, D.C. that suggested that this is going to poof, disappear one day. We just need to expose as many people as possible. But what about the people we're exposing? And when you're a person of color like I am, you take issue with the fact that someone in authority is suggesting that we not wear masks and expose everyone to it, when you see that the people that are dying faster than any other group of people are people who are from Black and brown communities. So that is why our leader, Basilis Santana, decided to have this conversation, and we thank you all, and the numbers, a couple hundred people participating today. We thank you all for having the audacity to give ear to what we believe is scientific knowledge and the right advice we can give to all communities, but for this conversation, mostly communities of color. Do you see the scientific definition? Herd immunity is the immunity or the resistance of a particular infection. We're talking about clearly the coronavirus, where a group of people at a high percentage, there's that 70, 75 or 80% that you hear that Dr. Fauci talks about, and you can accomplish herd immunity, as we just discussed, through vaccination or exposure. We do not want to do it through exposure, so vaccination is the best alternative. If you have a better alternative, then we should talk about that, but it has to be scientific, and I would argue that there is no better alternative today. So let's transition into Operation Warp Speed. So I'm going to get deeper and deeper into science, so please open up your minds, stop what you're doing, and pay attention to this. So Operation Warp Speed, i.e., in other words, it's an accelerated vaccine process. You will see by the red circle that the typical process, look at that horizontal line there, the typical process takes how long? 73 months. You divide that by 12, you're looking at 6 years. I submit to every person on this line, in this conversation, to the listening audience, that if we waited 73 months, I would argue that some people in this conversation will not be here 6 years later. So we can't wait that long. Thank goodness there was an mRNA or an RNA technology that existed prior to the pandemic that companies like Pfizer and Moderna and others were already experimenting on, and they were focused on cancer. They were trying to create, they were in the process of creating, and fingers crossed they will be successful, in the process of creating a vaccine for cancer as well as a treatment for cancer with this new technology. Now, so how were they able to, you see the second number in that red circle, how were we able to, and they forecasted or predicted that they would have this done in 14-month period. So are they skipping steps? The answer is no. Did they negatively impact efficacy? No. Did they negatively impact safety? No. Did they negatively impact the quality of the vaccine? No. And here's why. Here's why. Drop down to the bottom of the slide and look at the legend that we see there. Let's look at the colors, right? So you have the dark blue. That is the time it took in the typical process, which you see up top is 3 months. That is where they did research and development. Preclinical trials. Jot this down or put it in your memory. Preclinical means prior to humans. Preclinical animals. Preclinical animals. Clinical humans. Clinical humans. Preclinical trials, when they expose animals to this, typically that would take 3 months. What you need to know is that for typical processes, they go step by step. They don't do 1 and jump to 3. They don't do the first and jump to the 5th. They do the preclinical trials first. When that's done, 3 months later, they start phase 1 clinical trials. Humans. What is a phase 1 clinical trial versus a phase 2 and a phase 3? Here's another note you need to take. Phase 1, you know, preclinical means animals. Clinical means humans. Phase 1, hundreds of people. Phase 2, phase 1, less than 100 people. Phase 1, less than 100 people. Phase 2, hundreds of people. Phase 3, these are humans, thousands of people. And before you, in the typical process, after you research with the animals, you do phase 1, which takes 5 months. Look at that. Phase 2, 21 months. Phase 3, 23 months. After you're done with that, then you ask the FDA for approval. The CDC's advisory committee makes recommendations on who can take it and who shouldn't. And then you start distribution, which takes over a year, 15 months as you see for the brown color. And then comes the distribution, which takes 6 months. We couldn't afford to wait that long. And there's no negative impact on the safety, efficacy, or the quality of the vaccine. Here's why. Go down to the accelerated process. They combine the research and development, the preclinical trials with phase 1. How were they able to combine and do that and go from 8 months to 5 months, Eadie? Well, it's simple. We're in the midst of a pandemic. We have a tridemic, and people are raising their hands like Dr. Harwell, who you saw on the video earlier. He decided to raise his hand. This is a Harvard Medical School professor and researcher. I mean, arguably, they get no better than people like Dr. Harwell, but he had the nerve, because he believes in this and the science as a scientist, to raise his hand, and he wanted to participate. And then look at the next phase under the accelerated process, 6 months. They went from the 21 months in phase 2 clinical trials, the 23 months in phase 3 clinical trials. So what is that? 44 months. And they broke that down and reduced it down to 6 months, which is a huge catalyst, if you will, or acceleration of the production of a vaccine. So how were they able to do that? Again, because we're in the middle of a crisis. They went from phase 1, which is just less than 100. They were able to, because of the number of people, witnessing people die every single day, they were able to enroll from hundreds to thousands of people, phase 2 and phase 3, almost overnight. And in the midst of all that, because you have now, in a short period of time, now we're at 11 months versus 52 months, they were able to reduce it down to that shorter period of time. But now let's go to the brown. But you see, the typical process to manufacture the vaccine takes over a year, 15 months. Because they were signing people up by the hundreds and thousands every single day, they had to massively produce the vaccine. That's why they have so much vaccine today, and that's why the amount of time that went from 15 months went to 0 months. And then the last part of the accelerated process is simply the distribution, which they were only able to reduce it from 6 months to 3 months. But still, they did that, and they forecasted it would take 14 months. So look, notice, they went in step-by-step order for a typical process, and this answers one of the questions that we saw in the chat. How were they able to do it so quickly? They went from a step-by-step process that takes 73 months to doing things in parallel, simultaneously, concomitantly, so that they reduced it down to 14 months, is what the strategy or strategic plan was. But listen, the vaccine started in February. So truth be told, it was less than a year. It was less than 12 months, certainly less than 14 months, by which they produced a vaccine. So I hope you see this slide. I hope it makes sense to you. The next time you ask yourself, or you are asked as leaders in your community or households or members of your household and leaders of your family, when you're asked, are you comfortable about that? Just based on what I just said, you now know that the only difference between the 6 years and the less than 1 year is they didn't do things in series or stepwise fashion. They did things in parallel or concomitantly. They did it all at the same time. And that's the only reason why on a Saturday, when we got final approval for the Pfizer vaccine, they were in hospitals and being injected 2 days later on that Monday, which was this week. So I hope I addressed that to your comfort. Now let's get a little more scientific. But before I get into that, there was a question in the chat that said, what impact, how does the RNA technology work, and what impact does it have on a human cell? These next 3 slides are going to answer that question. Stay with me for just a second. So this is an analogy. Imagine I got an assignment from my wife that said, go to Costco and buy us a new kitchen table. And please hurry up and bring that table back, because I would like to eat dinner on that table this evening. The red circle represents or illustrates everything that happens inside of Costco. So Reggie Eadie walks into Costco with a large cart. I go down the aisle. I find kitchen tables. I see the big box of the one that my wife wants, and I load it in on the cart. I roll up to the register with this big box. Now, what's in the box? You know what's in the box. Look at the arrow. The instruction manual usually is at the top. When you comb through the instruction manual, you see the parts necessary to build this kitchen table in this analogy, and the tools, because nowadays they give you tools instead of telling you what tools you need to have. They give you what you need to assemble it yourself. But I'm Reggie Eadie, and I'm not a skillful person, and I can't assemble things like our boss list or like my dad, may he rest in peace. So instead, I pay the extra money. So whatever that amount is, I pay, and I say, do me a favor, Costco, why don't you put the kitchen table together? Just put it together for me. I'll come back in about an hour or two. and I'll take the whole kitchen table, put it in the back of probably Brother Harwell's pickup truck, and I'll take it home. Brother Harwell and I can take it into my kitchen, and I'm a hero because I've accomplished what my wife set me out to do. All that happens within Costco. Once they pull the kitchen table, assembled kitchen table up to me, because look, the assembler is the person in Costco that put it together for me. This will all make sense in just a second. Then I leave Costco with the big cart. I load it on Brother Hartwell's pickup truck, and then I take it home, and we can enjoy that kitchen table. My wife appreciates that I accomplished it successfully. And if you understand that simple analogy, I promise you, you're going to understand how DNA and RNA works. Let's move to the next slide. So let's talk about a cell inside of your human body. The red circle is no longer Costco. It is now the human cell. The box is no longer the box. It is now DNA. So what's in DNA? Same thing that's in the box. It's instructions. It's instructions on how your human cell will grow, how often it'll grow, what it'll grow into. It defines your DNA, which is your genetic code. It's your instruction manual. It defines what this cell will produce. Remember, cells can produce multiple things, right? They can produce proteins. They can produce other cells exactly like it. It can produce some different type of cell. So that's what DNA does, which is equivalent to the box that I rolled up to the counter. Then there's RNA. So here's the answer to the question that someone put into the chat. What does RNA do? Well, RNA is the assembler. It's the person, if you will, in the back of Costco that took the box at the table in the box that I had already paid for. They open it up. What do? They do the same thing you do when you get home with your box. You open the instruction manual. Hopefully you do this. You open the instruction manual, you read it. You pull out all the tools, you lay it out on the floor, you put all the parts on the floor, and then you put it together. Well, inside of your cell, your DNA is the instruction manual. Your RNA is the thing that puts it together, whatever it's making. In that analogy, it was a kitchen table. And then once it's done, your cell releases into your bloodstream that final product, that equivalent of the assembled kitchen table. Now, to the extent you got that, that's DNA, instructions. That's RNA, the worker who puts it together, who does the work, and then it releases outside of the human cell whatever the DNA told it to release. Now, if you got that, check this out. Now, what this slide is going to show you, and I need you to pay attention to this, and I'm going to use my arm and things like that. So check this out. The coronavirus, top left corner of your slide. Let's talk about how that works. And once you understand how that works, which you already understand once I deliver it to you, once you understand how, and I'm going to simplify it, obviously, once you understand how that works, then you're going to understand the importance of social distancing. You're going to understand the importance of wearing a mask and why the mask covers up your nose and your mouth. You're going to understand all of this. So let's go back to the top left corner, the coronavirus. So you see the red things on the coronavirus. It's in every picture illustrating the coronavirus you see. It's there for a reason. There is no coincidence with God, right? There is no coincidence in anything. Oranges are orange. Apples are red, green, or yellow, or red with green stripes, or red with yellow stripes. That's all because our Creator has created a significance to that color. And that's why at a young age, we're taught colors first, because colors have a meaning. So what does the red mean on this coronavirus? Well, the stem that protrudes from the coronavirus, let's say this is my arm here. That's what I'll call, and stay with me, that's what I'll call the spike protein. The top of this spike protein, which you see sitting on the top, it looks like a crown under the microscope. In science, we try to confuse you and make you think that we're smarter than you are. So we don't call it a crown, we call it a corona, which means a crown. So the coronavirus, because it's a virus under the microscope, it looks like it has these spike proteins with a crown on top, like a king or a queen. So the coronavirus has a circular, just like your cell, configuration with these spikes sticking out with the crown, which is my fist equivalent, on the end. How does the coronavirus work? How does it infect your cell? How does it make you sick? Why does it kill people? Here's why. One coronavirus, you remember early on in the pandemic, one coronavirus cannot exist unless it has access to a human cell. So remember, and if you heard me speak before, you heard me say this early on during the pandemic, remember we talked about fomites. We talked about the virus can be on the Amazon box sitting on your porch if the deliverer person or someone in the last few hours who touched your box had corona. It can be on your keyboard. It can be on your steering wheel. And that's why the sanitizer was so important to deactivate or kill the virus. But to the extent that one virus, just one, gets access to just one of your human cells, what will it do to your human cell? All right, spike protein, crown. Imagine this. The spike protein, the crown, attaches to your human cell. Boom, it's stuck on your human cell. That's what that arrow is demonstrated in there. It's attaching to one of your human cells. What that crown will do is punch holes in your human cell. And it punches holes in your human cell for one reason. That is to release its own RNA into your cell. Now remember, look at this picture, or go back to this one. You have DNA, you got half of it from your mother, you got half of it from your father. The instruction manual in your DNA is why you're the height that you are. Your foot size is the way it is. Your nose, your lips, your skin color, your hair texture, that's all defined by your box, by your DNA. And your RNA follows those instructions and it replaces the cells on your skin, the hair follicles in your hair. The reason why your nose is not changing that much over time is because the RNA simply follows the instruction. Well, when the coronavirus's spike protein and its crowns attached to your human cell and punch holes in it, now imagine you have two RNAs in your cell. You've got your RNA doing what your DNA tells it to do. Then it has the RNA from the coronavirus doing what it is told to do. And what is it told to do? It's told to make more coronaviruses. And it hijacks your cell to go from one coronavirus to two, from 2 to 4, from 4 to 8, 8 to 16, 16 to 32, etc. And if that coronavirus takes over cells that are responsible for your smelling, you lose your smell. Your taste, you lose your taste. In your lungs, it takes over your lungs. You have to be hospitalized because you're short of breath. You're placed on a ventilator, and a percentage of those people don't live. And that's how the coronavirus works. So now you know, based on the question that we were asked, how the coronavirus infects your cell. It attaches to your cell, punches hole, puts its RNA in there. The RNA, now you know, is the assembler in Costco. It makes things. What it spits out of that cell is another coronavirus. That's how the coronavirus works. Let's talk about this new technology, which was another question inside of the chat box. Please put your questions in the chat box. Our bossless will get to them. So quickly, the top left corner has a typical coronavirus. You see, they're components to the coronavirus. There's the lipid protein, there's the envelope protein, there's the membrane protein, and there's your spike protein. In the inside of the coronavirus, so they opened up 25% of the coronavirus, so you can see it. There's a squiggly worm-like thing that's called your RNA. You know what the RNA does. You already know. It produces whatever the DNA tells it to produce. Now, if as you saw in this example, if the entire amount of the coronavirus's RNA got into one of your human cells, it's going to spit out or produce and release into your blood what? Another coronavirus. In this case, these scientists were so smart, and they had already been working on this new RNA technology. Here's the answer to your question. They took the RNA out of the coronavirus, and they were able to determine what part of the RNA is only responsible for producing the spike protein and the crown. So when you get if you get your immunization, they're not injecting into you the coronavirus. They're simply injecting to you a piece of the coronavirus's RNA that once it's inside of your cell, it will produce not the whole coronavirus, but just the spike protein and the crown. Now, why were scientists so interested in just the spike protein and the crown? The reason why is because that is how, remember on this slide, that is how the coronavirus attaches to a human cell. It attaches by its crowns, punches holes, and deposits its RNA into your cell, producing another coronavirus. Scientists at Pfizer and Moderna were so smart that they said, well, let's just inject the RNA that produces the spike protein and the crown. Why? Because if they inject that into your muscles, and it hijacks your cell, if you will, and it produces only the spike protein. You see the spike protein is represented by the light green grapes, is what I like to call it on this slide. So it produces in your blood, your cells start producing spike proteins, just the spike protein with the crown, not the virus, not like this slide, just the spike protein. Your brain says that is a foreign object. I don't know what it is, so let's create antibodies against it. So now you get the vaccine. You get the first injection for Pfizer. 21 days later, you get the second injection. And then 7 to 10, 14 days after that, you have a blood full of antibodies waiting for your cells to be exposed to the coronavirus. So if you are exposed to the coronavirus, you have antibodies in your system so that when the coronavirus tries to attach to your cell, these antibodies will stop it and say, you're not coming in this cell. You are not punching holes in my cell, depositing your RNA and making another coronavirus. You're not even gonna come close to my human cells because I have antibodies to stop you. That's how Pfizer and Moderna's vaccines work. So now you know what RNA and DNA is. Now you know the role that the new technology of RNA plays. Now you know if you get them a Pfizer Moderna vaccine, they're only injecting a part of the RNA responsible for the spike in the crown. And then now you know you will make antibodies to that, not the whole virus, just to that part of the virus, which is the first step for it infecting or hijacking your cells. So let's transition a bit. Hopefully you got all that. I know that's a lot, but I tried to make it simple as possible for the non-scientific people. And listen, for any kids out there that are listening, let me be the first to tell you, it is not that hard being a doctor. You can absolutely be whatever you set your mind to. As a man thinketh in his heart, so is he or so is she. And all you need to do is believe that you can do it, and you will be creating vaccines, or you will be saving lives, just as the doctors in the front line people do in this country every single day. So the purpose of this slide is to compare and contrast Pfizer, Moderna, and AstraZeneca. Pfizer's already here. Moderna will be here next week. AstraZeneca will be here in a few weeks. So now when you are watching television or reading an article and they talk about this RNA technology, look at the first line. The type of vaccine. You see Pfizer's an RNA vaccine. You just learn how it works. You got that. You know more. The 200 people on this call know more than the average person on the planet knows now about coronavirus. Moderna's are also RNA-based. AstraZeneca is a little different because they actually inject a live but weakened adenovirus. What's an adenovirus? An adenovirus is the virus that causes a cold. All of us have had colds before, and it's caused by an adenovirus. So we'll get in that in just a second. So look at the doses. You all know that Pfizer requires 2 doses 21 days apart. Moderna 2 doses 28 days apart. AstraZeneca 2 doses 30 days apart. Then there's the efficacy. What does efficacy mean? Efficacy, if you Google it, for the most part, it is telling you that for every 100 people, percent, 100. For every 100 people that they gave the vaccine to, not the placebo is just salt water. For every 100 people they gave the Pfizer, Moderna, or AstraZeneca vaccine to, and now Johnson & Johnson, like Brother Harwell is in the research, for every 100, 95% of those people established an immunity and never got coronavirus. 5% of them, so 5 out of 100%, the remaining 5% actually did get coronavirus. I'll talk about the good news about that in just a second. For Moderna, it's 94%. For AstraZeneca, it's anywhere between 62 and 90%, depending upon which one they end up releasing once it's approved. But on average, it gives you an efficacy, effectiveness. How much does it protect you from the coronavirus? That's 70% on average. So 95%, 94%, and 70%. Now I'm done with the purple graph. Let's drop down to the green graph. So I thought I would compare those to vaccines that you've already taken. Let's look at the flu vaccine. So a difference is, you see the type above, it's RNA and RNA. The flu vaccine, and the point here is there's this narrative going around that this is this new stuff that we've never experienced before, so we should stay away from it. That's baloney. Look at this. The flu vaccine, it's a live but inactivated vaccine. It's a live vaccine. Pfizer's, the one you have in your state today, is not a live vaccine. It's a portion of the RNA that produces the spike protein in the crown. So arguably, that could probably be safer, but they're both safe. And then look, the dosages are once a year, they're annual. Why? Because the science showed that when you inject somebody with the flu vaccine, which I just got about 3 weeks ago, it lasts less than a year. So you got to get it every year. And they're smart enough to give it when? During flu season, because that's when you're really going to need it. And then the efficacy, you see the efficacy is between 40 and 60%. So let's say 50%. Remember Dr. Fauci said early on that if we can only get a vaccine to the coronavirus that has an efficacy of 50%, we'll be good to go. That's why he said 50%, because the flu vaccine is safe, it's high quality, it's effective 50% of the times. But we did better than the flu vaccine with this. And the flu doesn't kill as many people. It does kill, but not as many. It doesn't kill 4,000 people a day. So that's why you've taken the flu vaccine, you trusted it. I'm arguing that you should also trust this. Measles, mumps, and rubella. That's also a live but weakened and attenuated, weakened vaccine. Now look, I get emails and phone calls and text messages all the time saying, how come 2 shots? Well, here's what I'll tell you. You took measles, mumps, and rubella when you were a kid. Newsflash, it was 2 shots. One, and then 28 days later, you took another one. So when you look at the 2 shots for these vaccines, you're already used to that. This is not new, ladies and gentlemen. You just didn't know as much as you know now about this vaccine as you did the vaccines in the past. So don't let it discourage you. Don't create anxiety and hesitancy. Follow the science and trust the science. The efficacy for measles, mumps, and rubella, 97%. Better than the ones before, and you already took that, but these are very good. And listen, of 95% of the people getting immunity, that's great as far as I'm concerned. A couple things I need to tell you. First, let me go to the circle on the right. Of the remaining 5% or 5 of the 100 people who got the Pfizer vaccine, who still got infected, look at that circle in the bottom right. None of them needed hospitalization, and what percentage of them died? 0. So even if you do get exposed after you take the second shot and wait a couple weeks to coronavirus, you may still be able to spread it, which is why we're going to still wear masks until we reach herd immunity, but you won't need hospitalization and you won't die. And then you should just know that in the Pfizer study, they only injected people with the actual vaccine who were 13 and above. They didn't go less than or equal to 12 years old. Of the 16 and 17-year-olds, they only covered 153. Remember, phase 1 clinical trial, less than 100. Phase 2, hundreds. Phase 3, thousands. They only did 153, and that's why 4 people, they happen to be pediatricians, voted to not approve it. Not because they were questioning the efficacy of Pfizer's vaccine, the quality of Pfizer's vaccine, or the safety of the vaccine. They only voted no because they wanted to start 18 years old and above, because they looked at the number of participants between the ages of 16 and 17 and thought, that's not even phase 3. Let's just stick with 18. So they voted no. It got approved for 16 and above, and we just have to be cognizant of that. They also didn't include pregnant women and women that are lactating. So communities of color like to ask this question to us, and Greg has gotten this multiple times. How many Black people or people of color participate in the study? All right, so listen, here are the stats. I only highlighted the ones I'm going to go through. Almost half were female. Almost 10% were African American. Now, in the state of Connecticut, it's only about 6 or 7% African Americans in the state. This is a higher percentage. In this country, there's about 12, 13%, whatever the stat that reference that you refer to, but it's still very close and respectable. 26.2% were from the Latinx community. Wow. I mean, that to me, it's very common. If it was 1% or 0% people of color, then I would question it. But when they released this data, which was verified by both the FDA and the CDC, I'm good with it. Greater than or equal to 65 years old, 21%. Greater than or equal to 75%, just under 5%. The average age of all the participants, 51. And then remember the narrative at the beginning, and then let's go back to February and March. First, they said if you're a person of color, you're immune to it. Well, that couldn't be further from the truth. So don't believe that narrative, because we all know that brown and Black people die at a higher rate than non-brown and Black people. But they also said if you're obese, you got a problem. If you have comorbidities like diabetes, you're surely going to die. If you have lung disease, it's a wrap because you're going to need a ventilator and you're not going to do good. So Pfizer took that under consideration. 35% were obese, dispelled that. 8.4% had a comorbidity and a complex comorbidity because it lowers your immune system, diabetes. And then almost 8% had known chronic lung disease. Remember, how many people died when they took this Pfizer vaccine? Zero. So this tells the story and tells the safety. Now here's one of my favorite slides for this conversation. You know the efficacy for Pfizer, we're just talking about Pfizer, was 95%. But then everyone wants to know, well, tell me about the subgroups. How did you get to that 95%? Well, I'll let you peruse that left column on your own. But check this out. For communities of color, I'm not making this up. This is not Dr. Eadie's or Greg Jones's or our Basilis data. This is Pfizer's data that the FDA and CDC approved. The efficacy for African Americans is a whopping 100%. 100%. Not 95, not 92, it's 100%. The Latinx community, 94%. And then people want to talk about side effects. I'm not going to go through this for the sake of time, but suffice it to say that the side effects in the first column are in descending order. The most common complaint is soreness at the injection site where you got the immunization. Then came fatigue, headache, muscle pain, chills, joint pain, and fever. You should go to the Tau Iota website and watch the entire video of Dr. Harwell. He will tell you all about his side effects. Now, he had a Johnson & Johnson immunization, which we're not talking about today, but it's not much different. Here are the salient points to this slide. Everybody will likely get side effects. The side effects probably won't happen after your first dose. They'll happen after your second dose. If you get side effects, it will likely be gone within 24 hours. Dr. Harwell's interview that Dr. Jones and I, that Greg Jones and I conducted, he did all the talking, but I was learning from that brother. He said that he got the vaccine in the afternoon, he went home, and then he got sick overnight. He had a rough night, but by the time he woke up and took a shower, he was back to normal. You should also know that the older you are, the less side effects you will have. So in other words, you see in the highlight, most of the side effects were in people between the ages of 16 and 55. Remember, they only had 153 people between the ages of 16 and 17. Majority of the side effects were between the ages of 18 and 55. People over 55 had very little side effects whatsoever. The last point I'm making, you need to get this. The reason why when you get infected by, let's say, the flu virus, the reason why you get body aches, headaches, fevers, chills, is because that is your body fighting off the virus. So when you get the injection and you get side effects, you should be doing jumping jacks, because what it means is that your body is creating an immune response to the spike protein in the crown, and the side effects of the immune response that your body is doing, meaning is doing its job, are things like fatigue, headache, muscle pains, fever, joint pain, etc. So the side effects only mean that the vaccine is working. And plus, if you're over 55, you may not get it. And if you're not and you do get it, they will be gone within a 24-hour period. So I think Motrin and Tylenol is really all you need. Your doctor will tell you what to do, but you will be just fine. You won't need hospitalization. And most importantly, you won't die. Here's a picture of Trinity Health in New England, one of our hospitals, St. Francis. I actually literally, when we unboxed the box of vaccine we received, I literally took a picture of it with my cell phone, and that's it. Notice that it says the vial contains 5 doses. What you probably saw on the news yesterday is that you could actually get 6 doses out of that. The reason why they put an extra dose in there for the nurses, like Nurse Kevin, my fraternity brother, he can remind you or attest to the fact that when you draw or aspirate the medication in the syringe with the needle, you usually hold it up vertically, the needle points to the ceiling, you blow out the air because you don't want to inject the air, and that usually wastes the vaccine. Because this is so precious to us as a country, we're wasting the vaccine, so that extra dose in there can actually be injected into one of us. Here's a picture of Ivan Sarmiento, who just happens to be a hero of mine. Out of the 13,000 employees we have at Trinity Health in New England, he was the first to roll up his sleeves his sleeve and take the injection. He's an emergency department nurse at St. Francis, which, by the way, is one of the best hospitals in the country. But nonetheless, Ivan, in my opinion, was a hero because not only was he the soldier that rolled up his sleeve and took the vaccine, but he's a man of color. And hesitancy exists usually and mostly in communities of color. So high five to Ivan for the demonstration, the example that you gave us all as a trooper and a leader. I'm not going to go through this, but except to say that the vials have those 5 doses, sometimes 6. So when we say vial, nomenclature, then when we talk about trays, it's about the size of a small pizza box, a personal pan pizza for the pizza lovers. It's not a big box. But nonetheless, the box holds 195 vials. So 195 vials can get you 5 or 6 injections, and that's how we get to about 1,000 injections per tray. And then you heard about Pfizer. It has to be at super low temperature, minus 70 or lower, going in the negative direction, colder, and it can hold about 5 trays and it has to have dry ice. So I just want to touch on that because that's often a question. I'm not gonna. This is a slide on Connecticut. There are people who are not from Connecticut, so you can look at this on the website. We will post this whole conversation on the Tau Iota website per permission from our bosses. And these are the phases. Now, what we do know right now, and this is a draft because it's subject to change, and each state can do what it wants to do, but the FDA and the CDC gives recommendation. You know, in phase 1 that it's going to be healthcare workers who are caring for COVID patients and the nursing homes or long-term care facilities, because 40% of the deaths in this country, if I remember the statistic correctly, those deaths resulted in long-term care facilities. So it makes perfect sense to me to first take care of the people that are saving the lives, in addition, at the same time, take care where most of the deaths occur. And then there's 1B, and there are tiers to 1A. There's 1B, and as we go from phase 1 to 2 to 3 to 4, that's equivalent to us having more vaccines. So in phase 1, the supply of vaccine is much less than the demand. Phase 2, they start to equalize. Phase 3, the supply and demand becomes very close to each other. Phase 4, we have more vaccine than we do people who need it. This is the vaccine approval process. I'm not going to spend a lot of time on that. Suffice it to say that the companies have to apply for emergency use authorization. They have to get FDA approval, then CDC approval, and then your state, your respective state, will decide what it will be. In Connecticut, I happen to be, as Brother Jones indicated, honored to be a co-chair of the state of Connecticut's vaccine advisory group. Thank you, Governor. And then the governors of every state, which is equivalent to the president of the state, decides who will get it. I'm going to conclude with another question that was in the chat box. It talked about the masks. So these are 6 individuals. The first 5 may as well take their mask off. So before I go into those pictures, so stop reading it for a second, just listen to this. You now know, if you did it in the past, that the most common way that one gets infected, the most common way that the coronavirus has access to what? One of your human cells, so a spike protein its crown can attach, punch holes and put its RNA in and produce yet another coronavirus, is because the coronavirus is airborne for the most part. And the way it gets access to your cells most commonly is you breathe it in. It goes through your nose or it goes through your mouth. A third way, but to a much lower degree, that it has access to human cells, are through your eyes. So you see people doing the extra protection by wearing eye shields. But the fact, this is not anecdotal, this is not a guess, the fact that it's airborne and it needs a human cell to exist, otherwise it'll just die, is why we wear a mask. So the narrative that comes out somewhere that says you do not have to wear a mask is also baloney with cheese, I'll say, because the mask prevents it from you inhaling it when it's airborne or it going through your mouth. Most of us breathe through our mouth. Some exchange breaths through our mouth and our nose. Most of us breathe through our nose. Some exchange through our nose and our mouth. So we can access your cells both ways. So you have to wear the mask, and more importantly, you have to wear the mask correctly. Now you see the top right corner says your mask should either be medical grade or it should be multi-layered. A single layered mask that has your name on it, your favorite football team on it. If it's one layer, and it's not medical grade, you may as well throw it away. We're talking about saving lives here. We're not talking about trying to look smooth or cute. So you have to wear a mask, and you have to wear a mask correctly. This first woman may as well take her mask off because her nose is exposed. And when she walks on an elevator that has airborne corona, wearing her mask like that, she's going to get infected because that coronavirus has access to her cells. The second person, this gentleman, while his nose is totally covered, he's not covering up his chin. And when you don't cover up your chin and your nose completely, you see the third person that says they have gaps on the side of their mask. Here's the proof, and you can look in the mirror yourself. When you wear a mask, like this reporter was doing, I found this on Google, she is wearing a mask. It's not covering up her chin. The fact that she didn't cover up her chin, you see the gaps on the side of her mask. Corona can get right up in there, into her nose and into her mouth. So you have to wear your mask to cover up completely your nose all the way down to your chin. And then the fourth person, she is covering up her chin, but her nose is only partially covered. When your nose is only partially covered, see the gaps on the side of her nose? That's why there's a thin metal rod on the top of your mask so that you can pinch it and close off the gaps. This person has gaps on the side of her nose and can be exposed. And then this fifth person, like a many teenagers, is wearing the mask as if it's a turtleneck. And you might as well just throw it away and take it off. And it's hard to stop people when you're in the shopping mall or in the grocery store, say, put your mask on properly, because people get offended. But you have the responsibility to make sure you're wearing it properly. You've got the responsibility to make sure it's medical grade or multi-layer. And I will conclude by talking about 4 scientifically proven ways before you get the vaccine to create some protection. And the way it works is it prevents your the virus's spike protein and crown to some degree, not enough to think that this is going to protect you wholeheartedly. You will not get immunity from this, but to some degree. So my family and I, we take these things every day. Zinc, vitamin C, vitamin D, and melatonin provides some degree of protection. With that, I pray that this made sense to you. I pray that it gave you knowledge so that you can make an intelligent decision, not only for yourselves, but for the people that look up to you, to your children, to your spouse, to your friends, family, loved ones. And we need to spread this knowledge across the globe so that until we reach herd immunity, we can live longer and healthier lives as God intended for us to do. I will stop there with this last slide, and this is called the flow test. If you want to just test your slide, and this is not scientifically proven, but it will help you out to a degree. It's sort of like the melatonin, vitamin C, D, and zinc. Take a candle, hold it 6 inches in front of you. Clearly this person it's not 6 inches in front of her, and I'm not criticizing her. Maybe she did this on purpose so that we can use this illustration to teach. But 6 inches in front of you, put your mask on properly and blow. To the extent where you can blow out the candle or move the flame significantly, you need to get rid of that. Either readjust your mask and learn how to wear it properly, or get rid of the mask because it doesn't provide the protection that you need to live a long and healthy life. I will stop there and surrender my microphone and time to Brother Basilis. Thank you.
Brother Eadie, as always, your presentation was informative. It was just something exactly we all needed. I hope everyone took something from that presentation, and it allows you a little bit more peace of mind about making your decisions around this vaccine. So as we mentioned earlier, we've been taking questions in the Q&A section and in the chat section. So we're going to get right into that. We'll try to answer as many of these questions as possible. We'll start right here. Dr. Eadie, one of the questions is if you had it already, what are your chances you will get it again? And do you think you should still get the vaccine?
Yeah, so great, phenomenal, brilliant people. I love this. I love this. If we did this kind of stuff for everything in life, oh my God, we would be a much smarter community. So thank you for that question. So yeah, so what we're seeing right now, which you probably heard, that people who've had corona early on in the year are getting it again. That tells you that the immunity doesn't last forever. The exposure to the coronavirus. And that same thing will likely be true for the vaccine. That's why the flu vaccine is given every year. My guess, and this is just a guess because I could be 100% wrong, and I'm okay being wrong, and I hope I'm wrong. My guess is that we're going to have to get the coronavirus vaccine probably once a year, like we get the flu vaccine. Next question.
Thank you, brother. Another question that I will just paraphrase is, why does the Pfizer storage requirement have to be -70 to -80 degrees?
Yeah, so Moderna requires just a regular freezer like the one you have in your household. Pfizer requires a much lower temperature. So the research and the vaccine that Pfizer came up with, that protein, that RNA protein, which you know all about now, they found that at higher temperature, it falls apart. It denatures is what we call happening to the protein. So you have to keep it at that low temperature until you thaw it out, and you have to inject it immediately after in order for it to have the impact or the effect that we expect it to have. Moderna doesn't require that, and we think AstraZeneca, based on what I've read, can be in the regular refrigerator. So that's why, ladies and gentlemen, that's the only reason why so far, hospitals have the Pfizer. CVS and Walgreens will take the Pfizer to the long-term care facilities, but they too have to have a freezer that has the low freezer capabilities. Many hospitals had to go out and buy one. The subsequent vaccines don't require that, so that's why they will eventually be in a doctor's office near you or a pharmacy near you, because all you really need is a refrigerator to store them. Next question.
Thank you, brother. Another question is, should a person be concerned with taking the vaccination if they are on meds for diabetes, high blood pressure, and cholesterol?
They should be concerned, but not so concerned that you don't take the vaccine. Remember, they had 38% of people in the study that were obese, so that eliminates that. They also had, I don't remember the percentage, they had a number of people that were diabetic, like the question. So it's safe there. And then they had a number of people who had chronic lung disease, so it's proven to be safe there. Nobody died from the vaccine. The only group of people that really need to worry about anything are the people who have a history of anaphylactic reactions like I do. So you hear about these reactions. Now look, the reactions, these anaphylactic or severe allergic reactions, they happen. 1%, 1.6% of the population experiences this. I've had them multiple times. I'm supposed to carry an EpiPen. I don't every day, but I do carry my inhaler, and I have access to antihistamines, and I know how to treat myself as a physician. But for when I go to take the vaccine, which I hope to do in the very near future, I don't want to jump the line. When I go to take the vaccine, I'm going to ask a question. Do you have epinephrine on hand? I know that the hospitals at Trinity of New England, where they're giving vaccines, they have epinephrine. So if I have an anaphylactic reaction, they're going to inject me right away, which will start mitigating my severe allergic reaction. Then they will probably transfer me to the emergency department to observe me and continue to treat me. I, as an emergency medicine physician, have treated severe allergic reactions multiple times. And while it can kill people, as long as you engage in healthcare as quickly as possible, you'll do just fine. Not a reason to not take the vaccine. Next question.
Thank you, brother. Are there more than one strain, and what about mutations, and is that taken into account?
Yeah, so you know, just like mutations occur in your body all the time, and when you think of a disease, it is indicative of either the DNA or the RNA not working the way God intended for it to work. So mutations are going to happen. The reason why there are thousands of influenza viruses that cause the flu, and that's why every year the flu vaccine is different, because they look at last year's strongest strains of the flu and they inject those into the population, and that's why it's not 100% effective. But yes, we expect this to mutate, and that may mean that the technology or the science is going to have to continue to change over time. But right now, these vaccines, based on the current coronavirus, have efficacies of, as you know, 95, 94, and on average 70% respectively of the three we discussed. Next question. And one more thing, I see people are chiming in continuously. We love that. Please do not disengage in this conversation until we take the second poll, because we really need to know how effective we are in conversation, because our goal as Omega Psi Phi members is to save lives. That's who we are. That's what we do. But we need the feedback from you. So if you can just hold on a little longer, I know it's getting late, to take the vaccine. We just want to answer a couple more questions. Thank you, Brother Boston.
Thank you. If you have already gotten the virus and have antibodies, should you get the vaccine?
You should get the vaccine because it doesn't last forever. But now the conversation we're having at Trinity Health of New England is, if you had a recent, meaning within 12 months and the pandemic isn't 12 months old, then you may let somebody who's not had it get the vaccine first, because remember, we're limited supply of vaccines. So if people are comfortable, that we ask them to just, wait a little while before you get it. But if they're uncomfortable and they want to get it now and they qualify for phase 1A, we allow them to get it. Next question.
Thank you. One of the questions here talks about long-term side effects and how do we plan for those long-term side effects with the compressed time period?
Great question. If you saw 60 Minutes about 3 or 4 Sundays ago, they talked about, I'm trying to remember the term that they coined. They called them long-timers. So in other words, people who survived through the pandemic are having long-term, what we call in healthcare, sequelae, or long-term side effects from the virus. Now, how long they will last, the science hasn't answered that question yet, because we've only been in this pandemic for less than 12 months. But nonetheless, that's why another reason why you should consider strongly getting the vaccine. Because if you take the passive route and just wait until you get the disease, which you eventually will, then the problem is you may have these long-term sequelae. I will also, in the spirit of transparency, I will also tell you that we don't know the long-term impact of this vaccine either. What we do know, though, is since the research has started, that no one got real sick and no one died. But you see commercials every single day that say, if you took this medication, I don't know, 20 years ago, call this law office because we can sue. There are always side effects. But here's the news that I'm going to remind you of that people don't like to hear, but it's true. Many of us on this line take prescribed medications every single day. What do you know about that prescribed medication? Rhetorical, but probably not a lot. Some of us do, but the vast majority do not. I know a lot about these vaccines. I take a blood pressure medication every day. I could never give a 30-minute presentation on the medication I take every single day. I could also not tell you about the food I ate today and yesterday. I can tell you we got it from a Kroger or a Stop and Shop, but that's all I can give you. I don't know what farm it came from. I don't know how healthy the animal was. So my point is that this is not the time in the middle of 4,000 almost people dying a day for us to be questioning stuff that we have never questioned in the past. You didn't question the flu vaccine. You didn't question the measles, mumps, and rubella, or the food you ate or the water you drank. You didn't question any of that. So let's not just make a decision that we're not going to get the vaccine because somebody told us we shouldn't on social media who has no scientific background and just has a mere opinion. We know about opinions. But now after this conversation, we hope and pray as Omega Psi Phi Fraternity Incorporated that you have enough knowledge to make an intellectual decision instead of a decision that's based on emotions and some text or email you got on social media that made up some garbage about this vaccine.
Thank you, Dr. We actually have come to the end of most of the questions were answered during the presentation, so we can end that here. As Dr. E mentioned, we will present another poll now, and we'd like to get your, again, honest opinion on what you feel as though you will do with this vaccine. As Dr. Eadie said, we're trying to get metrics around our messaging to ensure that we are delivering the right message to the folks who need it. So your candor is definitely appreciated when dealing with the poll. Again, I'd like to thank Dr. Eadie, Dr. Greg Jones. He says he only plays a doctor on television, but he wears many hats. I'd like to thank both of them for presenting tonight. This has been a phenomenal discussion. I hope folks have left here armed with a little bit more information about what they should do and what works best for them. Any closing remarks, Dr. Eadie and Brother Jones?
Brother Jones, I'll yield to you first. You're the older fraternity brother. Not older in age, but older in knowledge and wisdom.
All I can say is the more that I listen to Dr. Eadie about this, the more that I'm convinced. And when we said that 85% of the people trust their physicians when they get it, like Dr. Eadie has delivered, we understand why. Prior to this, we know 50% of people had questions. When we are able to expand this conversation out, we're able to give folks the facts over fears, and understanding what the history is. We're not glossing over that. But I appreciate everyone's attention. We had well over 150, 175 people here throughout the evening. I hope that this serves as some way for you to be an ambassador about information. And I ask you to sell anything, but just sharing information. and use our website, use the Tau Iota Q's website for updated information on the videos that we shared here. But most importantly, thank you for taking your time this evening to join us to learn more about the COVID-19 vaccine. Mask up, stay home.
And I would just end very quickly by saying, and I see Tasha McEvans, there are a number of names popping up, but I'm just going to call her out and embarrass her, who's a little sister to me in the city of Detroit. So Tasha McEvans and everyone else out there in the listening audience, we're doing this again on, remind me of the date, is the 27th at 7 p.m. So listen, to the extent where we didn't answer your question, there was something that we said you didn't understand. Not only should you tune back in on the 27th at 7 p.m., but you need to invite your friends, your family, your church, your sororities, your fraternities. Invite every person, regardless of their age, their past medical history, their skin color, the social economics. Everybody needs to hear this, whether they take the vaccine or not, so we can have an intelligent conversation as Americans about how in the heck we can remove these masks and get back to hugging, kissing, shaking hands, and being around each other like we do as people. So thank you very much. God bless you. I give all the credit to our bossless, who's the visionary around this whole conversation. It's an honor to work with an esteemed brother, Greg Jones. God bless us all as a people. God bless us as a fraternity. And God bless the vaccine so that it can cure or create immunity and herd immunity for all of us so that we can get back to normalcy. Thank you. It was a pleasure.
Thank you, Dr. Eadie. On those words, we will end for tonight. Again, remember, tauiotaqs.org. You could register for next Sunday's session, the 27th, and you'll find some more information with those videos. Again, tell a friend, tell a family member, come join us again and learn some more. Thank you again. Have a good night, everyone.
Real.